Okay, so now that you know something about vessels, let's talk about the words that we use to construct the words that we use to describe vessels. So once again, we have three combining forms here: angio, vasculo, and vaso. Once again, we see a drawing I actually really like here on the side. This is a very simple depiction of how things go. So blood's coming from the heart down that red artery through the capillary beds. It gradually turns to blue as the hemoglobin gives up the oxygen molecule and picks up a CO2 molecule. And then it goes back to the other side of the capillary bed through the venules to the vein, back to the heart, and repeat over and over and over until things don't work anymore. All right, so angio being our first combining form, and it means vessel. Angiocarditis. So there's a combination of cardio and angio put together. That's inflammation of the heart and the blood vessels. Can be a very serious condition. An angiogram is an x-ray of a blood vessel. So it's a complicated process. I won't describe all of it to you. You see one right here. You see the internal carotid artery, and that is indicating an aneurysm. I will get into the word aneurysm later, but just as a brief drive-by definition, it's when a weakened portion of a blood vessel, almost always an artery, begins to expand in a balloon-like way. And it can be dangerous, and it does require attention, and we'll look at that later. So there is, what you're seeing right there is a cerebral aneurysm. So the internal carotid artery rising up from the neck into the brain, and this little bubble right there. And once again, we'll hit aneurysm a little bit later. I'll give you more information about what those are and what they potentially mean. Also using the term, or the combining form angio, we can do angioplasty. This is a surgical repair of a vessel. This is a procedure used to widen, narrow, or clogged blood vessels and restores blood flow. So we have something called plaque that can build up in our body in different places. And when it's in the cardiovascular system, it's potentially dangerous because it could block an artery. So you always, number one defense for yourself and patients and family and everyone else is protect cardiac health so that plaque doesn't develop. However, it will develop with time, regardless of how perfect you eat. And when it does, if it becomes problematic, angioplasty can be done to fix it. If you look at the two radiographs we have here, the one on the left shows the narrowed artery. The reason it's narrowed is because that artery has a very small passage that blood will flow through, and there's contrast that's been injected into this patient's vascular system. So the contrast only has a small channel it can go through, and that's how they can see there's a blockage. And that was before surgery. After the angioplasty, when they've placed a stent, and that's that spring-like looking thing you see in the diagram on the right, they place a stent, it opens it back up. You cannot remove plaque from an artery without potentially harming the patient in a bad way. So they don't disturb plaque, they simply find a way to work around it. Now, when we talk about the aorta, I mentioned it earlier, it's the largest artery in the body. It has its own combining form, aorto. Aortic means pertaining to the aorta. Aortostenosis, I don't know why that's difficult. Aortostenosis is a narrowing of the aorta. So theoretically, you could have something like plaque build up in the aorta. Although given the size of the blood vessel, it's not very likely that plaque would build up there. That would be harmful, but it's possible. There are other things like arteriospasm, where the muscles in the arteries might spasm out, causing a narrowing of the aorta. It's going to raise blood pressure. It's going to slow down oxygen distribution. It's going to cause the heart to work harder because now there's resistance. Something's pushing back against the heart as it wants blood to flow through a nice open channel, but that channel is now narrowed for whatever reason, and that's aortostenosis. Could happen with any artery. We're just referring to the aorta here. There's that word again. Aneurysm. This one is a tricky one to spell, so do note the spelling. Abnormal dilation of a blood vessel that balloons out and can potentially rupture. So that's basically what happens. I'd mentioned earlier that smoking, for instance, can break down collagen in the body. It's one of the reasons that the bronchioles will collapse in the lungs and the alveoli will have air trapped in them forever and ever. Collagen breaks down on its own. So aneurysms are things that can happen on their own. If you want to accelerate that process, things like cigarette smoking will do it for you. So this type of aneurysm you're seeing here is in the abdomen. It's the aorta. And I just referred to aortostenosis in the frame before that. This is the opposite of that. This is now it's bigger than it should be because it's under so much pressure. So smoking and hypertension are two of the biggest reasons this happens. If you have this type of aneurysm and you're a smoker, many times they won't even consider surgery because you have to meet certain protocol. So in this case, the aorta, the collagen is broken down, the resilience of the tissue has broken down, and now it's beginning to balloon out, as you can see here. If and when that should happen to rupture, it would mean basically loss of life within probably 30 to 45 seconds, depending on how severe and quickly the rupture happened. But that's always the risk with the aneurysm, that it can rupture and it could cause, a pathology or a downward spiral, let's say. If it's the aorta that ruptures, well, there's no fixing that really, unless it happens during a surgery. They might be able to do something. The aneurysm I showed you earlier, that was the internal carotid artery. That was the type of aneurysm my grandmother died from when she was in her mid-90s. She was gardening all day, came in to take a nap. She laid down. She had an aneurysm in her brain that we didn't know about, and it burst, and she had a very peaceful death. So we're sad to see her go, but she got to go in a very peaceful way. Not everyone gets that kind of easy death, so bless her heart for that. But that's what she died from, and this is what a AAA would look like. A AAA is an ascending abdominal aneurysm. Okay, now another combining form for artery, which is dealing with blood vessels, is arterio. And once again, this is the combining form for artery as an arteriole pertaining to an artery. Arteriostenosis is a narrowing of an artery. Arteriospasm is a spasm of an artery. Arteriorexis is the rupture of an artery. And we see a profile up here. You'll notice if you look at those layers that it's the same types of layers that we see in the heart. The arteries have their own musculature that surround the vessel, and they help control blood pressure by expanding and contracting. Veins do not have this. A vein is simply a tube made of tissue. But an artery, actually, it's a tube made of tissue, but it also has a muscle layer, so it can actually control the size of its lumen. If that muscle should happen to spasm and lock it down, that's an arteriospasm. Arteriosclerosis. Okay, we're going into a pathology that happens to all of us if you live long enough. It's otherwise known as hardening of the arteries. It's a group of diseases characterized by a thickening and hardening of the arterial walls, and it results in a decreased blood supply. So that plaque that I mentioned to you earlier, that happens for multiple reasons. Diet's a big one. So low cholesterol diets will produce less plaque. Stress and increased cortisol levels in your blood can cause plaque to build up. So sometimes long periods of endured stress can cause permanent damage to the arteries and may induce some really bad side effects. The takeaway on this one is arteriosclerosis, and there's two forms I'm going to talk about. This particular form, arteriosclerosis, happens as a process of aging. You may have had a perfect diet, never drank alcohol, never smoked a cigarette, didn't do anything you shouldn't do, were a vegan your entire life, and you're healthy as can be, and you can run a marathon. You're still going to have some arteriosclerosis. It's just a matter of the process of our bodies after they've hit their peak of slowly sort of, approaching their demise. So this is part of the process. This happens to anyone if you live long enough. Anybody in their 60s or 70s is going to have a little bit of this in their bloodstream. Probably won't ever be an issue, but it's still there. That's arteriosclerosis. It's a little bit different than this form. And this one starts with the term athero. So you'll see sclerosis is still there, but now it's atherosclerosis. And this is fatty plaque. So this is built up in the arteries. That's a result of diet, primarily. With some folks, and I do know of several patients who have a family history of atherosclerosis, and they know it, and they treat it, and they eat a low cholesterol diet, and they produce plaque nevertheless. So it isn't always the fault of the patient, and medicine's not really a blame game anyway, but it's not always the dietary choices that may lead to this type of fatty plaque, although it is one thing that we can control to reduce plaque in the arteries. Most meats will help us produce plaque. Pork is one of the highest. So I know there's been, the thought in the last few years you can eat as much meat as you want, the sort of keto diet philosophy. You can live on bacon and lose weight, and there's some truth to that. You can live on bacon, and you can eat ice cream with it, and you can lose weight. What they are failing to tell you is you're still putting fatty plaque in your arteries, and you're begging and playing with fate. You're begging for this type of plaque to build up in the coronary arteries, and then you have a situation that has to be managed, because at that point you'll have something called coronary artery disease. or you or your patient or the individual that we're speaking of will have coronary artery disease. Now, if you recall, I said the coronary arteries deal with the arteries on the outside of the heart. The heart's a muscle and it needs its own blood supply. So it does pump blood to the entire body. It also pumps blood back to itself. And those are the coronary arteries that feed blood back into the muscle of the heart. In other words, the myocardium. This is another name for this is coronary artery or coronary heart disease, or just straight heart disease. It's caused by atherosclerosis. It's the leading cause of death for both men and women in the United States. About 13 million Americans have symptoms of coronary artery disease. So when we talk about coronary artery disease, we're talking about high cholesterol, and the result of high cholesterol in some folks is building up of plaque. If you have a high cholesterol diet and you're very active and you burn a lot of that cholesterol off in the blood, you're less likely to have plaque buildup in the arteries. But if you have a very sedentary lifestyle and a high cholesterol diet, chances of building up that plaque are very good. So if you want to eat bacon and ice cream, you also need to do 3 hours of cardio a day to burn all of it off. And you might come out of it okay. That's not advice. That's just anecdotal from what I've been told by cardiologists. Now, something that could be done would be an endarterectomy. This is not commonly done because it's dangerous. And it may affect the blood supply, especially, let's say you're going to do it it can, by the way, only be done in arteries that are easily accessible. And really the two that you have there, or the four that you have that are accessible, are the femoral arteries in the medial aspect of the legs, right below the groin area, and the carotid arteries that you have in your neck. Those you can palpate your carotids if you feel for the side of your Adam's apple or your larynx and feel for your pulse, and you'll feel that heartbeat there. Well, that is your carotid artery. You have one on each side. If you have one that's perfectly clear and one that's partially blocked, they may try to do a surgical removing of the lining of that artery. But chances are they're not. So the carotid and femoral arteries are the four potential locations for this. But often if one artery is blocked, the other is blocked. And if there is the risk of damaging that artery, they will not do an endarterectomy. So in order to reduce plaque, it's not a good plan. It is really completely ineffectual when we talk about the coronary arteries. As I mentioned before, we cannot remove the plaque from those. We put a stent in, hopefully, to get the blood supply. Or there is actually one other technique we're going to talk about as well in just a few moments. I'm going to pause it here, and I'll be right back with some information about chest pain.